The Oncotype DX test is another very helpful test that we can use in the armamentarium to diagnose and potentially help make the best treatment option for patients with prostate cancer. It is suited and ideally recommended for patients with low-grade and low intermediate grade prostate cancer. So again, who is that? Those are the patients with these Gleason 6 prostate cancers or these very small volume with a low PSA Gleason 7 prostate cancers that we, again, want to look at the inner workings of those cancer cells. So from a pathology perspective, again, that pathologist will look at those cancer cells and come up with a pathologic diagnosis. The Oncotype DX will actually go deeper, and it will look at the expression of specific genes within those cancer cells. If that expression of those genes is higher, that is a type of cancer that actually will have a higher risk that cancer will continue to grow at a faster rate. So that lets us know that those patients are not going to be the best candidates to follow closely. Again, the end game on this, we don't want to treat too much for some of those patients actually who have low-grade cancer, but we also don't want to miss the boat. If we catch these patients early enough, and we can certainly classify those patients who are potentially good candidates for active surveillance, and the Oncotype DX actually, again, will focus in on those patients and say, this is a patient with a low-grade cancer and looks like it will behave as a low-grade cancer, we all feel more comfortable that the chances that cancer will continue to grow and that we're missing something is going to be low. Likewise, we are also looking at those patients with actually higher grade, and what I mean by higher grade, I mean by intermediate grade, not these 8s, 9s, and 10s, and certainly not high volume Gleason 7, but these either the low intermediate grade or high volume Gleason 6s, technically NCCN guidelines, very low risk, and what Oncotype is actually described as a low intermediate risk. You can classify those patients, and all of a sudden, those patients now become at a higher risk. That's a patient who very likely is not going to be a good candidate for us to follow closely.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.